Our last speaker, I hope you don't mind me saying this. So most our speakers up until now have mostly been computer scientists, AI, fully trained uh, um, researchers. Martha Silva, Dr. Silva, our last speaker, has a degree in public health, PhD from us. She is assistant professor in our school in international health and sustainable development. Her research focuses on health services research and social behavior change evidence generation for program and policy improvement. From 2018 to 2023, she was data strategist and innovation team lead for the Breakthrough Research Project, a USAID cooperative agreement tasked with advancing social and behavior change by promoting evidence-based solutions to health and development programs around the world. In this role, Dr. Silva worked with BR partners to identify strategic and innovative ways to collect, analyze, and use qualitative and quantitative data to strengthen program interventions in Africa and Latin America. And I preceded this by saying she's not the computer scientist, and so she's going to be talking about her explorations using ChatGPT for qualitative research and comparing that with the more standard qualitative methods that you all are probably familiar with. So very interesting talk. Welcome, Dr. Silva.
Thank you very much. Yeah, what Paul meant to say is that I am the public health practitioner and researcher in the room, not a computer science person, but very excited to learn about this. So over the next 10 minutes, I'll try to summarize our journey over the last 6 years, incorporating AI-powered tools and social listening for public health research and evaluation. So the year is 2019, and I've been tasked with evaluating a USAID-funded social and behavior change campaign to strengthen the normative environment in support of sexual and reproductive health in Francophone West Africa. And as often is the case in what used to be the USAID world, when USAID was still a thing, the project was complex. It was spanning 9 countries, and the evaluation budget wasn't very big. The project start was imminent. We needed a strategy by yesterday. So because part of the complex multi-country campaign that I had to evaluate was happening online, I was able to explore this new approach that I was hearing about called social listening, and was ultimately able to incorporate it as part of a multi-method evaluation strategy. The more that I was exploring this tool, I realized that as public health practitioners and researchers, we were miles behind the marketing people, the computer science people that had figured out long before us that internet-based data carried a wealth of information from health and behavior, and that it really allows you to look at things in the moment, so stream of consciousness, as Aaron was saying. So since I was using social listening for the first time, I was really looking to understand whether this tool would be versatile enough to serve as a monitoring, research, and evaluation tool, and whether it would be sensitive enough to capture changes over time. So happy with the opportunity that this tool was allowing us to have. I started working in partnership with MC Saatchi, which is a marketing firm that, among other things, does social listening for their clients. And most of their clients are in industry. They help them create commercial advantage. So for those of you that don't know what social listening is, this is monitoring and analyzing social media content that is related to or relevant to a specific topic of interest. We use Boolean search string to identify and extract internet-based content relevant to what we wanted to study. Then we used a proprietary algorithm to analyze the data and identify relevant conversation to our health evaluation. So what did we find? In a nutshell, yes, social listening is a useful methodological approach for public health research and evaluation. We wanted to know, can we produce actionable insights for public health programs for adaptive management? Yes, we can. The first QR code will lead you to a case study from the campaign in Francophone West Africa that got me started in this path. We also wanted to test, can social listening tools capture narrative changes over time, so say over a 5-year time period? And we tried this out using data related to gender-based violence in Nigeria over a period of 5 years. And we found that yes, social listening tools can help us understand trends in online narrative about sensitive subjects. You can read our paper in the second QR code. And the problem that we were facing at this stage is that we were still relying on contracts with MC Saatchi and using proprietary algorithms to do this work. So the next question became, how can we, how can we how can the average public health practitioner do this without expensive subscriptions or contracts? So, can we do social listening quickly and rigorously without expensive subscriptions? And so last year, a team of us here at Celia Scott Weatherhead School, we started this project, and we decided to test whether ChatGPT could serve as an inductive qualitative research assistant. So we already knew that ChatGPT, under the right circumstances, could code data deductively, meaning that if you provided a code book and it can sort through the data according to the code book. But could we provide instruction to develop a code book based on the data, give it a large data set of internet-based data, and generate actionable insights that we could trust quickly and cheaply? We sourced data using a social listening platform called Sprout Social, and we applied a Boolean search string, generated a database of around 85,000 posts related to abortion, and this was right around the time when Roe v. Wade was overturned, so in 2022. Our inquiry was whether or not and to what extent had internet-based narratives about abortion changed over a time period, and also comparing two different languages. So this is what we did. We reviewed the literature and developed a script based on best practices, some of the best practices that have been mentioned by previous speakers, working with large language models, and we piloted the script over many weeks to refine it, so the corkscrew really is reflecting iteration. We had to really balance the specificity, the length, and also the complexity of what we were asking ChatGPT to do. We opened two $22 a month paid subscriptions in ChatGPT, and in one account, we implemented the script guiding ChatGPT through inductive qualitative analysis, step by step, and with interaction and with feedback from a human analyst. As a team, we conducted quality checks to assess intercoder agreement between ChatGPT and a human analyst. And in the second account, we ran the inductive qualitative analysis script without any user feedback or interaction. We did this 40 times to see what kind of variability we would find between these iterations. We are still in the process of completing the last round of analysis, validation, and comparison, so the lessons learned and considerations we bring are still a work in progress. Having said this, our first impression has been that ChatGPT is not yet as smart as we had hoped it was going to be. Our expectations were really great, and the results were a tad bit underwhelming. So what you're seeing here is surely too small for you to study in detail, but what I'm showing you is the percent agreement in coding between ChatGPT and a human member of our team. And suffice it to say that there are 19 lines in this bar graph and only 8 are green. So this means that for over half of the codes identified and coded by ChatGPT, we did not agree with the way ChatGPT was coding, despite the instruction, the user interaction, and the refinements. So as I said, we're not done. We're just about to do a last iteration and a combined inductive-deductive approach, but we already have plenty of lessons learned. We've heard this before, script writing is a skill set. Thankfully, researchers in this field are publishing their scripts as supplementary material, and we were able to learn a lot from what others have done already, and we plan to do the same. I've said this before, it wasn't as smart as we thought it was going to be quite yet, and perhaps we need to modify our expectations of what ChatGPT is useful for at this stage. So a brief example of one thing that ChatGPT cannot do yet is understands the nuanced difference between support and opposition to abortion. So that was really crucial to our research. So it just kept getting it wrong. A few considerations. Setup, resources required may not be accessible to the average public health practitioner. You need good Wi-Fi, a good computer and processor. Also, the models are changing so frequently that by the time we were done running an iteration in a certain model, there was already a newer model out. And we kept wondering, will this newer model do a better job? We ran iterations in a couple of models. We could not see a discernible difference with the scope of tasks that we were asking ChatGPT to do. So the newer models were not necessarily acting any better. So as I said, we haven't been impressed enough yet to trust ChatGPT as a full team member. But had we been impressed, we've had many discussions about how do we consider the impact on public health workforce, work opportunities for research assistants, work opportunities for students, and what their role is. Ultimately, doing social listening with ChatGPT has been cheaper than partnering with MC Saatchi. But it hasn't yet saved us time, and we haven't reached the desired threshold for validity. But we're not giving up yet, and probably our biggest lesson learned is that we should have reached out to our colleagues at the Center for Community Engaged AI much sooner. So as a next phase, we're hoping to partner across disciplines to build a custom interface to reduce the pain points that we've encountered in our experiment, and hopefully get closer to having a tool that is fast, cheap, and more rigorous. And in the midst of all of this, we continue to ponder how do we balance the environmental footprint, public health usability, and also accessibility of these tools. I'll end with just much appreciation for our team and by putting faces and names here so that you can interact with them and ask them all the questions. And particularly Dr. Jenny Stillo, who will be leading the next phase of this project. So thank you very much.